Everybody, Dr. Rob Silverman here. How are you? I hope everybody had a great holiday. Everybody knows that I'm all about the gut-to-brain axis. It's one of the things that I really like to staple myself with as a particular highway. I like to refer to it as the super highway to health. Whatever you do to your gut, you do to your brain. Whatever you do to your brain, you do to your gut. You have some gut damage, you really lead yourself down a path to have some brain issues. And literature is really robust in the idea that if you've got gut damage, that you lead yourself down a path of neurodegenerative disease. So really wanted to touch base on a few things in reference to that, in reference to what I would suggest you guys could start today. There's a lot of diets out there, and any diet is probably better than the standard American diet. The standard American diet is called SAD, or the Western diet. We've seen how deleterious it is to everybody's overall health. So at some point I'll talk about the different options, like a GAPS diet, like a DASH diet, like a MIND diet, a Mediterranean diet, very popular, very positive Mediterranean diet, what an AIP diet is, so on and so forth. For today, I'm going to talk about the keto diet. Now, for me, the keto is one of my more favorite choices, and I just want to say with a slight disclaimer at the beginning, I don't adhere or subscribe, if you will, to any one diet. I usually pick tenets of specific diets because I want to individualize and personalize what that patient, you and I, what you need for your health goals and your genetic potential. So we all talk about a diet and we all talk about macronutrients and everything like that. So everybody that comes to me is going to get something different. I'll have some basic things, no gluten, no dairy. So one, I'm a big proponent of the keto diet. The keto diet is approximately 75% of your calories coming from fat, 20% of your calories coming from protein, and 5% of your calories coming from carbohydrates. If you keep yourself typically for a day, not easy, 50 grams or less in carbohydrates, you're going to be in what we call ketosis. If you get it to 25 grams a day or less, you're without question going to have weight loss. Now, one big thing about the keto diet that I like is I prefer the clean keto versus the dirty keto. Now, what do I mean by that? The dirty keto is the same macronutrients as the clean keto. By the way, I don't count calories. I count chemicals. I don't count calories. I count nutrients. I don't count calories. I count satiety. So if you were to take those three things and you were to look at the clean and the dirty keto, you'll understand some of the ideas that I have within the clean keto. The dirty and the clean keto have virtually the same calories and very similar macronutrient disbursement. But in the macronutrients, the clean keto is no dairy. So there's no butter. However, you can have clarified butter. You can have ghee. They have the same macronutrient composition. The only difference is they don't have any dairy because the milk particles have been burnt away. So no dairy, no gluten. You shouldn't be eating gluten anyway on any ketogenic diet. So certain subtleties, I'm going to ask for grass-fed beef, so better organic type of beef. I'm not going to have that processed deli kind of meat, those deli sausages versus an organic chicken sausage where you may get at a Whole Foods or a Wegman or the like. So for me, it's all about the clean versus the dirty keto. Having said all that, in November of 2020, a great article came out in Advances in Nutrition, and it talked about the ketogenic diet effect on how it can help or alter the gut microbiome. So, and actually, it's from May 20th online, UCSF research. Gave you the wrong citation before, apologize for that. So keto diets can really alter the gut microbiome. So various studies have suggested the potential for anti-inflammatory properties of ketone bodies via the effects on the gut microbiota ecosystem. So ketone bodies. The whole premise of getting into ketosis is being able to burn fat in place of carbohydrates and produce these ketone bodies. The ketone body of note, or what I like to refer to as the gold medal winner, is beta-hydroxybutyrate. Beta-hydroxybutyrate has a pleiotropic effect in that it's not only a health signaling agent, it's also an energy. These ketone bodies, especially beta-hydroxybutyrate, are great fuel for the body, but most predominantly great fuel for the brain. And now we're seeing excellent fuel to produce a lot of health-inducing properties in the gut microbiota. So therefore, the production of ketone bodies, or anything that produces ketone bodies, is a great choice. These ketone bodies also have that positive effect on your gut ecosystem, your good and bad bacteria. So one thing about your gut ecosystem that you want to know is you want more good versus bad bacteria. So two things I'm always looking to do is I'm always looking to detect a trigger that damages your gut ecosystem, and I'm also checking to see your barriers. The addition to it is I want to know who's living in there, your ecosystem, good and bad bacteria. And it's apparent now through this year and data that is truly growing that ketone bodies from ketosis is leading towards good neighbors and good inhabitants in your ecosystem. Studies have also suggested that producing these ketone bodies is a great therapy for what we call autoimmune disorders, which can affect the gut. Now, how do you get an autoimmune disorder from the gut? It's very interesting. That comes into the barrier system. So your gut is a single layer epithelial cell that has the thickness of a wet paper towel. Yet if you stretched it out, it has a surface area of a tennis court. A lot of surface area in there. The purpose to that thin epithelial layer is to allow for digested small food particles, nutrients, vitamins, and water to get through, go in your bloodstream, and feed your cells. The problem becomes when the barrier is open too high and your digestion is aberrant, where you can't break down large digested food particles. When those large digested food particles come through, your immune system goes on alert, presses the fire alarm, comes in, and through a cascade of different events leads you down a path of localized inflammation, systemic inflammation, and then ultimately what we call autoimmunity. Your body starts to attack itself because many different food particles mimic to the immune system different body parts. Great example, gluten confuses your immune system, and gluten looks just like the back of your brain called the cerebellum. And at one point I'll do a future Facebook Live where we'll talk about all those perspective foods and what they damage. As a matter of fact, in chapter 2 of my upcoming book, which is coming out in May, we talk and I list all the different foods, or a litany of different foods that lead you down a path of autoimmunity. So the more presence of added ketones is enough to produce many specific microbiota changes seen in the ketogenic diet. So the ketogenic diet is a big thumbs up for gut health. 80% of your immune cells are in your gut. It's where your macro and micronutrients are absorbed. It's a great starting point. So what I referred to this study before, this came out just in November 2020, Advances in Nutrition. There were 10 randomized controlled trials that were identified for the ketogenic diet's effect on Alzheimer's. Now, we all know about Alzheimer's. It's the 6th leading cause of death. 1 American dies every 65 seconds from Alzheimer's. We realize that neurodegenerative disease, Alzheimer's is a neurodegenerative disease, is on the rise. This rise is leading us down a projection of 1/2 of Americans will have some form of neurodegenerative symptomology by 2050. So that is hopefully in my lifetime. Alzheimer's also, there's a difference between Alzheimer's and dementia. Nevertheless, all these neurodegenerative diseases like Alzheimer's, interesting, all these differences of neurodegenerative disease like Alzheimer's have a gut starting point. So I see that I have a couple of questions popping up. I'm just going to go through the slide, and I'm going to ask a good friend of mine there, Michelle Antonelli. 45 to 180 days, people were adhering to the ketogenic diet. Interesting. So it was a month and a half up to 6 months. How did they do it? Well, they had an intake of keto drinks. They had medium-chain triglyceride powders. One note about medium-chain triglycerides. Medium-chain triglycerides are not only good for your brain. They're great fuel. It should be C8 and C10. It's also great fuel for your gut. They also incorporated medium-chain triglyceride capsules, keto formulas, and meals. So they were using exogenous MCT oil to produce ketone bodies. I will tell you this, if you can't get into ketosis, and again, my goal is always to have a patient in ketosis, to become keto adapted where you're burning fat for energy and no longer using carbohydrates, I recommend exogenous ketones because they are a health promoting benefit. To continue with the idea of the keto diet's effect on Alzheimer's disease, the conclusion from the study was as follows. It was quite effective, the ketogenic diet, in improving general cognition using Alzheimer's assessment scale. So those in the placebo had a higher Alzheimer's assessment versus those who were on the ketogenic diet. Interesting, long-term ketogenic therapy improved episodic and secondary memory. So those taking ketogenic diet didn't have the memory loss. Guys, let's go feed good fat. Let's avoid crappy carbohydrates. One little aside to that, as everybody must remember, diabetes type 3 used to be called the cause of Alzheimer's. No longer we say that. So one of the great things you can do with any kind of neurodegenerative disease is, again, impart to the patient or the person a low carbohydrate diet and use a high fat quality diet. There's some variants. There's some Alzheimer's variants. It's called APOE. Now, there's three. There's an APOE2, there's an APOE3, and there's the one that's very damaging, ruinous, APOE4. The APOE4 is a specific allele that, or variant, that leads you down a path of having a high propensity towards Alzheimer's. 25 to 30% of Americans have it. The APO3 is approximately 70%. That's actually what I have. That's like sort of milquetoast. It's not here, it's not there. And APOE2, almost nobody has it. You would be pristine. Now, interesting, if you had a positive APOE4 allele, which you get from mommy or daddy, versus a negative, the ketone concentration and cognitive performance was greatly differed if you had the APOE4. You got a delayed response if you had an APOE4 from ketone bodies. So even if you're on a ketone or a ketogenic diet, you're getting ketone bodies. If you've got the APOE4, you're not going to respond as well. So obviously, my suggestion, if you have the Alzheimer's variant, is to start now and go hard. The improved response, you almost had no improved response with the APOE4. They found out that virtually fish oils had no positive outcome if you had the APOE4 versus if you didn't. So a lot's going to be with diet, a lot's going to be with lifestyle. And things of that nature. Now, I had a good question here from Michelle. She talked about the difference between the keto and the AIP diet. Ketogenic diet, as we said earlier, 75% fat, 20% protein, 5% carbohydrates. AIP, autoimmune protocol. So essentially, you are removing, as opposed to testing for food sensitivities and food allergies, you are removing high allergy foods or food sensitivities, or foods that you think are stimulating some sort of adverse effect. You take them out, and then after 3 months, you put them back in. So that's really the AIP diet, interestingly enough. We do that all the time. We call that the reintroduction phase. I don't do that as much, and I'll tell you why. I do reintroduce. I usually start with food sensitivities, because food sensitivities are a sign of two things. They're a sign of a barrier, a leaky gut barrier, and they're also a sign of poor digestion. So for me to have a patient with a food sensitivity, I know a lot's going on with their gut, and I'm looking to make a strong wholesale change. And by doing so, I am going to take those foods out that they're sensitive to. I use KBMO. KBMO is my food sensitivity test. Anybody listening out there that wants to get the test, I'm happy to get it for you. It comes right to your house. It can be just as simple for any patient that I send it to, a finger prick. And if not, if you want to go to the lab, they can do a blood draw. So some of the other things that really help in production of ketone bodies and also for gut health are intermittent fasting, or what I like to refer to as time restrictive eating. So essentially, time restrictive eating is fasting for several hours in a day and eating in several hours. So there's two different windows: window of fasting, window of eating. My favorite windows of fasting for most of my patients over the last few years has been 14 to 16 hours of fasting and approximately 8 to 10 hours of eating. That 8-hour approximate window of eating has really been backed up by a large number of articles that really speak to its effectiveness. So what we found out through the time restrictive eating, that I had a positive outcome on body composition measurements, lipid profiles, fat mass were decreased, your waist will decrease. Intermittent fasting and time restrictive eating was associated with a high weight loss, and they had positive changes in what we call lipid profiles of total cholesterol, HDL, LDL, and triglycerides. So this is simple. There's no supplement. It's very simple. There's no powder to make. It's simple. I'm not asking you to change any foods just yet. All I'm talking about is to eat within that window. Now, more so than that, what I like about the time restrictive eating is it produces something called autophagy, which won a 2016 Nobel Prize. Essentially, autophagy refers to the idea of cellular cleaning. So when you fast, your cells will now clean. They'll scrub because they have time. They're not doing work digesting. When they're eating and you're eating too much over a long period of time, your cells are duplicating, and that runs into an issue. You want to clean them and break them down, and then you want them to grow back. Autophagy is the idea of cell breakdown, using that energy to revamp with new cells. Great for immunity, great for overall health. Let me go over some ideas on autophagy on an article that just came out this year. It plays a key role in maintaining intestinal homeostasis, regulating the interaction between the gut microbiota and the innate and adaptive immunity. So remember, we talked a lot about the idea of dysbiosis leading to some damage in the gut barrier, stimulating the immune system. Innate is one of your arms of immune system, adaptive is another arm of immune system. Together, they need to be balanced so you have a proper immune response. When you don't get those proper immune responses, you can lead yourself down a path of chronic inflammation and most commonly autoimmunity. So autophagy is great for the gut because it actually allows for intestinal homeostasis. It allows also the autophagy and maintenance of intestinal barrier integrity. So that pristine gut layer, that small intestine, is going to stay in its intact form. It also has an excellent role, a positive role in control of the gut microbiota composition. So therefore, it's going to decrease the incidence of dysbiosis. So first you have a barrier issue, then you have dysbiosis, and ultimately dysbiosis may lead to endotoxemia. If you can get rid of the dysbiosis, your leaky gut's not going to have the adverse effect that it typically has on most people's health. It also, autophagy helps reduce endoplasmic reticulum stress response in various and immune diseases. Again, 80% of your immune cells are in your gut, and it's going to decrease the incidence of immune diseases and inflammation. It also can lead to mitophagy. Autophagy leads to mitophagy. Mitophagy is the breakdown of mitochondria. You want to break your mitochondria down. You want to revamp with new mitochondria. What's your number one mitochondrial area? Your number one mitochondria area is, guess what? Your brain. Thank you. I needed some of this. Your number one mitochondrial area is your brain. So the breakdown of mitochondria and the growing back, the rejuvenation of mitochondria allows you to have more enriched energy in your body, and also limits the amount of reactive oxygen species, which is these free radicals that come out after the breakdown of mitochondria. And last, and maybe not least, without question, one of the biggest things is that autophagy decreases the inflammasome, or the NLRP3 inflammasome. This activation, which occurs in your gut from when endotoxemia, lipopolysaccharide, comes out. This lipopolysaccharide is in the inside of your gut. It has to have, you have to have, a leaky gut. You then have to have dysbiosis. Then you have to release this endotoxin, this lipopolysaccharide, and then when it goes out, it stimulates at the gut level and beyond NLRP3. NLRP3 stimulates the inflammatory pathway of NF-kappa B, which leads to the release of cytokines and interleukins, and if you will, all hell breaks loose and you have an 8-alarm fire. At that point, autophagy decreases this inflammasome activation. So just from adhering to the ketogenic diet, intermittent fasting, time restrictive eating, and combining them, you're going to have a great health outcome. So let me see if there were any other questions, or I know it's a Sunday. So that was it. That's great. So hopefully I can imparted some good information to you. Some of these points were very salient for everybody listening. It's always my pleasure. Dr. Rob Silverman,